When I first get a person laying face down, I want to get a read of how their back feels, how their muscle feels. I have sort of a broad contact, and I don't have to do it this way, but this is a pretty good way of feeling. I do a little bit of rocking with it, and just sort of feel the back. Now this back feels firmly balanced when I feel it. A little bit more tension in here compared to here. Yeah, it feels like the left is a little bit more tense, generally speaking. So I do that. There's a little bit of rocking. Very often the patient feels comfortable. The patient's getting used that I'm touching their back. They haven't had that happen. Some people never had that happen. But we got to be very... It's a big honor that we get to work on them. I wanted us to look at the patient that way. It's an honor that they let us work on it. They trust us. We want to establish trust with the patient. And then after I've done that, I sort of go back up on both sides of the spine. I right now use my fingertips. I do a little bit of bouncing back and forth, trying to not impose my bouncing onto them, but trying to find where the patient sort of is. They have a lot of cough, they're all nervous and wiry, and they exude that energy to me, or do they, are about ready to fall asleep because they had a long day at work and they're tired of it and they just want to zonk out. That's okay too. So I go up both sides of the spine, up and down a little bit. I have the spinal processes of the spine are right in here. I can also use knuckles here, for example, depending. My upper body is pretty stable. I don't go like that and then I push in with the elbow. I have this be fairly stable and I move with my legs and with my trunk. So I have this be balanced and I have the upper body be balanced, and sort of we bring the force through the arms, but my action comes out of my pelvis and out of my legs. I don't want to lean into the person too much, even though that is a sort of a tendency to what we do. But I do want to lean into the table a little bit and use the table as sort of a guide for me, and then work out of the knees and the thighs. So when I push in, it comes out of my trunk, or the trunk is stiff, and it comes out of my core, and not just as a tension out of my elbows and my upper arms. And very often that translates to the patient of, again, solid, trust, safety, security. So I do that for about a minute, going up and down the spine and just feeling it. We want to be slow. We want to convey calmness to the body and not franticness. We want to bring to the patient an energy of healing. So once I go up and down the spine, I take a little bit of time, a minute or two. I then go more specific. In the low back, I want to go out. This is the crest, the iliac crest right here. I want to move lateral, out on that, right on the crest. And I'm going to feel a few places that are a little bit more dense in tissue, the way it feels, tissue density. Those are areas where I want to hang out a little bit more. Sometimes I take my contact, like my fingers right here. I feel like there's a tension right in here. And I don't feel like my fingers can just do this. I want to not just poke, I want to use a fairly broad spectrum approach. So if I need a poker because I want to be specific, right in here with my hand, with my finger, I got it. I can come above, on top of it, and I can sort of lean into it. I can almost relax my fingers and match the tissue tension of the body, because I have a hand on top of it that can bring the force from behind. I'm not doing this. I'm slowly gliding in and letting my body, my hand, match where the patient's at, and then just sort of hang out on one of these tricky points. And push it a little bit, but always be aware being slow and trying to match where the person's at. So I can do a couple of points on the outside. I do that on both sides here. Then we go up the spine. One of the techniques we can use is the thumb. Now we go on one side first and then the other side. Again, I go up the spine, I find out trigger points, I find out dense spots, and I find one right here, for example. Again, I can do this with the thumb alone, but I can also bring my hand, my palm, over the thumb and put much more force and broaden the contact, and so make it more comfortable for the patient. If I get better at it, and I train my elbow, I can also go in and I can bring the elbow in. When I bring the elbow in, I want to be very careful to not cross the spine. If I find the spot, this patient's very delicate, and the muscle sort of is a wire that's almost like a steel string, and I run the risk of finding a point and then it moves. I move my hand over and the wire underneath jumps to the side a little bit. I want to be very careful about that, that doesn't happen. And if it does happen, I need to be really in tune that I know and I feel when does it jump so I can let go of it and I can take the pressure off, because the pressure needs to be on the wire. Next to the wire, the body is usually more vulnerable, and that can hurt, especially if it's something like an elbow that's a fair amount of weight. So I go up a little bit, take a few points, 3-4 points, spend a little time there. One technique we call cross friction, which is kind of what I talked about. The danger is that it jumps underneath the fingers, the muscle fascicle or muscle itself. But the cross friction, if the fibers go this way, we go a little bit across as a general finding of what's going on, and then also the working. That's not a bad thing at all. That's a good thing. So it's a good technique. And if in this process the body sort of tightens up and you feel the muscles tighten up, we can go back and do a little bit more global. Like here I'm doing a little rocking because some of these muscles are a little bit tight. We also see how very often one section of the spine is more tight than another section of the spine. That depends on what does the person do all day. What is their habits? How is their posture? For example, this area here is very tight in many people because we kind of stoop forward. Our head goes forward. The tension comes all the way here to hold up this head and hold up this trunk. Very often in ladies with the bra strap, we also have the tension here because the weight of their breast is held singly through this strap, or that's one of the major places. So this is a place where we have a lot of force going into the muscles and into the spine.